Hi, my name's Tara Winward, and I'm going to be doing the intramuscular injection again, I guess. I just tried to upload it and it wouldn't upload, so let me go back to my medication. So it's going to be the morphine. So I would verify the order, and the order is morphine 4 milligrams per ml, but the order is 6 milligrams of morphine IM 1 dose. So I would give 1.5 mLs, which would equal the 6 milligrams. So I would first verify the order as I did, 6 milligrams of morphine, which comes out to 1.5 mLs. And then I would verify the 6 rights of medication. So it'd be the right patient, right dose, right patient, right medication, right dose, right route, right time, right documentation. And then I would gather my supplies and head for my patient's room. When I get there, I would knock, provide privacy, and introduce myself. My name's Tara, and I'm going to be your nurse today. I am here to give your morphine injection. Morphine is a pain medication for severe pain. You may experience heart pounding, chest pain, nausea, vomiting, extreme drowsiness, and if those get worse, then contact your provider. Then I would also allow the patient to ask any questions. Oh, well, let me back up. I would verify the patient by 2 identifiers, name and date of birth. Then I would ask for allergies. If they had any environmental allergies, medication allergies, food allergies, anything like that. Then I would explain the morphine. It's a pain medication. Heart pounding, nausea, vomiting, extreme dizziness, chest pain. If those persist, contact your doctor. And then I would allow the patient to ask any questions. At that time, I would perform hand hygiene, put on my gloves, pull my medication. So I would start with an alcohol prep pad, clean the top of my vial, so that way I'm not cross-contaminating anything. I would then pull back to 1.5. Push the air into there. Ensure that there's no air bubbles. And again, that would be 1.5 mLs, and that is equal to 6 milligrams of morphine. I'd locate the patient's deltoid muscle. This is the acromion process. I'd go 2 finger lengths below that, and then in another finger length down to the middle of the muscle. I'd palpate and assess the patient's skin to ensure that there is no masses, no lesions, no bruising, no tenderness or anything. If so, I would rotate areas. So then I'd grab an alcohol pad. I would clean in circular motion from the inside to the out. Allow that to dry. Grab the skin. Pull the skin tight to ensure. Bevel up. Then I would go in at a 90-degree angle. And I'd go quickly to ensure that my patient doesn't have any pain. I'd stabilize the needle here. And then I would slowly inject the medication to decrease any pain. When it was done, I would sit there a few more seconds to allow the medicine to go into that muscle. When I removed the needle, I'll cover it with a gauze pad. I will not massage the area. Activate my safety, discard into a sharps container. Ensure that my patient's doing okay. Remove my gloves, get rid of my supplies. Perform hand hygiene again and document the procedure. Thank you.